All right, welcome everyone. Thank you so much for joining us for today's BeWell education session. My name is Mariah Bruner, and I am UCA's Wellness Coordinator serving faculty and staff. A couple of housekeeping items before we get started. We are going to have our presentation, and then at the end, we'll leave plenty of time for questions and answers. And so if you have a question, don't be shy. You can go ahead and put it in the chat. Just know that we'll likely wait to the end to get to that, but feel free to just pop that in the chat or hold it to the end, whatever you prefer. And then also BeWell participants, you can earn 5 lifestyle rewards for the session, and stick around to the end and I'll share the information for how to claim those 5 points. So stick around for that. And then I'm going to introduce our speaker. So today we have Erin Wells. She is a certified health education specialist who is pursuing her Master's of Health Promotion here at UCA, and she is going to be graduating this summer. So congratulations, Erin. She is currently a program manager at UAMS, where she focuses on healthcare analytics and health education. So with that, Erin, I'm going to hand it over to you.
Thank you, and welcome everyone. So my presentation is over dental wellness. So we're going to start out with some objectives. There we are. And so by the end of the webinar, viewers will be able to identify 2 ways in which oral health is a part of physical health, list 1 common cause of tooth decay, list 1 strategy for promoting or maintaining good oral health, and identify 2 preventative services that are covered in full by UCA's dental insurance. So to kick this off, I would like to start up with a poll, and this poll is completely anonymous, but there it is. It should be popping up. And the question is, do you visit a dentist for a cleaning and checkup on a regular basis? And so let's see what kind of answers y'all have. All right, so we've got a lot of good participation. Thank you, everyone. So it looks like the majority of y'all are visiting every 6 months. So that's great news. We're going to learn a little bit more about why it's important to go so often and some benefits of that as well. So up first, we have dental utilization rates. So this was a study by the American Dental Association on dental care utilization rates among working age adults. And as you see there in the light blue teal color, it actually shows a decline of utilization rates. So people are in adults aged 19 to 64 are actually visiting the dentist less than the other age groups listed on there. And that is a little dated. That's from 2014. So let's move on to something a little more recent. So this is COVID-19's impact on utilization rates. So this was another survey by the American Dental Association, and it showed 79% of dental practices were closed aside from seeing emergency visits during 2020. So maybe if you answered that you didn't go in the last 6 months, this could have been a reason why you weren't able to get there. 18% of dental offices were completely closed. So you can see there the total patient volume, how much it had decreased. So a lot of places had less than 5% of their normal patient volume. So that's a huge impact that the dental associations suffered from. So some oral health 101. So tooth decay and cavities. So what are they, right? Cavities are permanently damaged areas on the hard surfaces of your teeth that develop into tiny openings or holes. And this is actually the world's most common health problem because, I mean, I personally have had a couple of cavities. I'm sure several people have, so they're very common. So some symptoms: toothache, tooth sensitivity, hot or cold intolerance, visible holes, brown or black staining on the teeth, or even pain when biting. If cavities are not treated, they can actually get larger and affect deeper layers of the teeth. And this can lead to severe toothache, infection, and even tooth loss. So some causes of this is plaque formation and plaque attacks. So when plaque forms, it's actually a clear, sticky film that can coat your teeth. And this is due to eating a lot of sugars and starches and then not properly cleaning your teeth. Plaque attacks are the acid and plaque that removes minerals from your tooth's hard outer enamel. So the erosion is what actually causes the holes in your enamel to form, which causes the cavity. So there are several risk factors associated with cavities. The most common is tooth location, and typically it's the molars in the back of your teeth, and it's because they're more difficult to clean because they have a lot of pits and things and grooves. Certain foods and drinks that cling to your teeth for a long time. This could be milk, ice cream, honey, sugar, soda, dried fruit, cake, cookies, hard candy, things of that nature. And that actually occurs because the saliva can't wash away those foods as easily as it can other things. Frequent snacking or sipping. So when you steadily slip snacks or sugary drinks, it can get that bacteria in your mouth and it can fuel the acids that can attack your teeth. Inadequate brushing. If you do not brush your teeth soon after eating or drinking, that can cause the plaque to form quickly. Not getting enough fluoride, because this is a naturally occurring mineral that helps prevent cavities, which is why our water has added fluoride. And another fun fact one is heartburn. So heartburn can actually cause stomach acid to flow into your mouth, and it can wear away the enamel of your teeth and cause significant tooth damage. So let's test your knowledge. So feel free to utilize the chat or to unmute yourself. So up first, how many times a day should you brush your teeth?
After each meal.
Good job. So the American Dental Association suggests that you should brush your teeth at least twice a day. So the next one is, how long should you brush your teeth? Does anyone have any guesses?
For 2 minutes?
Correct, yes. So the American Dental Association recommends you brush your teeth for 2 minutes every time. The other question is, if your bristles are not fraying, how often should you replace your toothbrush? Any ideas?
Someone said 3 months in the chat. We're seeing a lot of 3 months, 6 months.
Perfect. Yes, so the American Dental Association recommends every 3 to 4 months, or if your bristles start to fray, you need to toss that immediately, because that means that the brush and the efficacy of the brush is not as good as it could have been. How about how often should you floss? Any ideas?
Chat says daily.
Daily.
Perfect. I think y'all are reading my notes. Y'all are doing great. And the last one, is oral health a part of your physical health? What do you think? Yes or no?
Yes.
Perfect. Yes, it is. So let's see why. So some barriers to oral health. So kind of what we went back to with the poll, you know, COVID-19 could have had an impact on some of the barriers to getting out and getting your regular dental care. You may have limited access to or availability of dental services. COVID-19 could have shut those down. You may have lack of awareness of the need for care. So you may not know that you need to seek care. You know, you may think that constant tooth pain is just normal. You could fear the cost, because a lot of people talk about how expensive the dentist is, and you could have a fear of the dental procedures. So what can oral health affect? It can affect your ability to eat, speak, smile, and even show emotions. You know, it might have self-esteem issues. It could affect your work performance and even your attendance at work. In physical health, like we said, it is a part of physical health. Your mouth is full of bacteria and it's mostly harmless, but it is an entry point for your digestive and respiratory tracts. So your oral health and your physical health, it is linked to many things. The first being an infection of the heart. So this is actually endocarditis. It's an infection of the inner lining of your heart chambers. This occurs because bacteria or other germs from another part of your body, like your mouth, can spread into your bloodstream and go to your heart. So other heart disease and stroke, so like cardiovascular disease, it may be linked to inflammation and infections that our oral bacteria can cause. Pneumonia, so certain bacteria in your mouth can be pulled into your lungs, causing pneumonia and other respiratory issues. And diabetes. So by reducing the body's resistance to infection, diabetes puts your gums at risk. Gum disease appears to be more frequent and severe among people who have diabetes. And it also has been shown to be linked to low birth rates and premature births. And we'll talk about that in just a second. So diabetes and physical health. So you're at a higher risk for mouth infections. So periodontal or gum disease can actually damage the gum and bones that hold your teeth in place and can lead to painful chewing problems. So, and gum disease can also make it more difficult to maintain blood glucose. Dry mouth can occur due to diabetes, and dry mouth happens when you don't have enough saliva, so the fluid that keeps your mouth wet. Diabetes can also cause the glucose levels in your saliva to increase, and together these may lead to a yeast infection or thrust in your mouth. So how do you maintain it? You want to control your blood sugar. You want to brush your teeth regularly. You want to floss regularly. You want to visit the dentist for routine checkups. Report any gum soreness to your dental provider. You want to quit smoking if you smoke, and take advantage of additional cleanings, which we'll get to in just a second. So oral health and pregnancy, like I said, it could be related to low birth rates. So when you're pregnant, it means you're brushing for 2. When your baby arrives, you can actually pass bad bacteria from your mouth to his or hers and increase the likelihood of them getting cavities as well. So they're more prone to gum disease and cavities, and you should see a dentist while you're pregnant because it's safe and recommended. If you have morning sickness, you can rinse with 1 teaspoon of baking soda in a glass of water after your sickness passes, and this helps to wash away the acid and protect your tooth enamel. You also could be eligible for 2 additional cleanings, and I will make note of that in just a couple minutes. So let's get into the benefits and services and what is covered. So all of UCA's dental plans covers this at no cost to you, and this is for those who are over 18. And there are other services that are covered in full for those under 18, but these are just specifically to those over 18. So it covers routine exams, x-rays, and routine cleanings. So how many do you get each year? So adults 18 years of age and older will receive 2 per calendar year of exams and cleanings. They will also receive 1 per calendar year of the x-rays that are bite wings, and they will also receive 1 full mouth x-rays every 5 years. So those are covered for free. You don't have to pay for it. Those are covered. So the dental extras, so what I was saying about the additional cleanings for pregnancy and diabetes, this is what that kind of falls in line with. So did you know that you have enhanced dental benefits at no extra cost to you? You can enroll in Blue Cross Blue Shield's Dental Extra Plan and incur no out-of-pocket expenses. And these enhanced benefits are actually valued at over $1,000 and covered 100%. And they do not apply toward your calendar year maximums, and there are no waiting periods. So how do you qualify? So if you have one of these conditions, diabetes, coronary artery disease, if you've suffered a stroke, if you have oral cancer, if you've had head and or neck cancers, and if you've had Sjogren's syndrome, or if you're pregnant, you may qualify for dental extras. So all of these that I mentioned are self-enrolled. They automatically enroll you, except for pregnancy. And Mariah is going to put a link in the chat for the portal where you can access more information about this. Okay. And if you want to learn more, there is a website you can visit here on the screen, and this is where you can find more information about your plan summaries, your dental extra benefits, your dental rollover benefits. You can access your account, and you can locate a dentist. And if you can't find any of the information you're looking for there, Rhonda Roberts' information is here, and she's actually on the call with us today as well. So you can contact her if the above information doesn't give you what you need. So to summarize, oral health is a part of your physical health. Proper oral care can help prevent not only mouth issues, but overall issues in your body. Benefits provided by UCA's dental plan do cover a number of preventative services. And if you have a chronic medical condition, you may qualify for dental extras. So what questions do you guys have?
Feel free to unmute yourselves, or you can pop a question in the chat.
Erin, this is Michelle Bergen. I have a question you may not or may be able to answer. What are your thoughts on all the additives of the whitening to toothpaste? I know me being one, I'm sensitive to that. So I'm always looking for a toothpaste without that whitening because it makes sure it gets into the pores of your teeth and makes your teeth hurt.
Sure. So I'm by no means a dental expert. So I do not have the answer to that question, but I'm sure that somebody maybe in the chat or we can find out more information about that and get it for you.
Okay.
Michelle, that's one of those questions I would probably say to just talk to your provider and get a really good recommendation on a toothpaste that works best for you and your situation since everybody's so different. I don't know, that's kind of a frustrating answer, but it's probably the best one.
Okay. Thank you.
Yes.
And I have a question about mouthwash. Are there any studies that show that using a mouthwash that has the bacteria killing ingredients, is that better or is it recommended at all? Along with, flossing and brushing and all that.
So when I was doing my research on the American Dental Association's website, I did not come across anything about certain types of mouthwash. So that may be another provider related question. But there was nothing in my research that I came across that identified whether one was better over the other.
Thank you.
We have a question in the chat. It says, our dental insurance covers a maximum of $1,000 per year. Is this normal across dental insurance companies? It is so easy to get to the maximum and encourages putting off dental care till the next year. Rhonda, do you want to handle that question?
Yes, I can. Actually, this year, that maximum did go up to $1,250, which is still, when you have a lot of dental work, it is easy to even get to that amount. But we do have, I don't have it pulled up in front of me, but we do have what's called a rollover. So I'd have to look up the criteria, but I believe if you get your routine cleanings every year, and let's say it's a year when you don't have a lot of major work done, then some of that maximum will carry over. I think $350 is all that will carry over every year until you've reached a carryover maximum of $1,000. So I'll be glad to talk to anyone more about that at any time. I'll need to look it up and make sure I know all the details.
And Rhonda, just so you know, I did put a link in the chat to our one pager on the rollover benefit that links directly to the HR website. So if anybody, you can glance at that first, but I know you're available for questions too. So, but just kind of general information is available in the chat. We do have another question in the chat. It says, does the dental insurance cover things like Invisalign for 16-year-old dependents who don't need braces, just a little alignment?
That is a good question, and I can check on that, but I haven't had anyone telling me that it wasn't covered, and I'm pretty sure by now several children or dependents have probably used that. So let me reach out to the representative from Blue Advantage, and I can get back with you. Do we know who asked that question?
It's Malcolm Smith. I can connect you on email. How about that? I'll get an email going after this session.
Sure.
For follow-up.
That works for me.
All right.
I also had some trouble with getting some information about this. I have several.
Teresa, you're breaking up a little bit. You want to try one more time? I think she's having an audio.
Okay. Can you hear me now?
It's pretty broken up. You know what, Teresa, why don't you either shoot me an email or email Rhonda directly? We're happy to get your answer or question answered. Anybody else? Okay. If you think of anything, put it in the chat. I'm going to share a couple of slides. Just a reminder about lifestyle rewards. So let me do that real quick. hold on, just give me one moment. There's this awkward pause here as I get things going. All right. Okay, so I just wanted to make sure that everybody was reminded that if you go and get your routine cleaning and checkup, that's 15 lifestyle reward points for BeWell participants, and you can get that twice a year. So that's 30 points towards your lifestyle rewards incentive to earn the bear bucks. So I just wanted to make sure that's a little extra incentive to get to the dentist every 6 months. And then we have our points for today. So whether you're watching this live or recorded, you can get the 5 lifestyle rewards for today's session on dental wellness. You can simply snap a picture on your cell phone and upload it, or you can take a screenshot, whatever works for you. Just make sure you get that submitted to your account on My Health Check 360. And if you have any questions about that, or if that's too complicated, you can just email me and I can just send you a certificate of attendance or something like that. That's no problem. Again, questions, feel free to reach out to Rhonda Roberts or anyone on the benefits team in HR. They're happy to help. If you're more familiar with getting in touch with me, that's fine too. You can just email me and I'll get you connected. I'll give one more moment for additional questions and then we will officially adjourn.
I have a question.
Okay.
On that, I saw the 15 points for the checkups. So my dentist does that at the same time I go get my teeth cleaned. So I can get both of those done at the same time. Is that?
Yeah, the general idea is that you will get 15 points for each preventative visit. So usually that includes both, if that makes sense. But we're not picky. We just want you to go to the dentist and get those preventative services. Whatever works for you, as long as you're going to the dentist and getting those checkups and those cleanings, we're good. One thing I forgot to mention is I'm going to put a survey link in the chat. I'd love for you all to take about a minute just to complete that. Here it comes. We do provide our feedback to our presenters. So that's helpful, especially to students like Aaron, who are getting ready to go out full-time into their careers or pursuing their careers, advancing their careers. So just take a moment to fill that out. We appreciate it. I'm going to officially adjourn us, but if you'd want to stay on, I'm sure Rhonda has a spare couple of moments. She can stay on and answer any additional questions. Thank you all so much for attending today. Hopefully you'll join us for outdoor yoga tomorrow at noon on the East Lawn of Mashburn Hall. And we also have an education session coming up next Thursday, and that one will be focused on hydration. Have a great afternoon, everyone.